Hi, everybody. It's Betty Jo, and today we're going to talk about Chapter 35, Confusion and Dementia. It starts in your book on page 505. Again, have your highlighter ready because everything highlighted is something you're going to see in a test near and dear to you very soon. I want to preface this lecture by saying I did add quite a bit of extra stuff because there are some things that I want to point out to you. Please don't worry if you're not responsible for remembering it. I just want to make sure that you guys have a little bit of background before, so that when we talk about dementia, it makes somewhat a little bit more sense to you. Okay, in starting on page 505, it talks about confusion, which is a state of being disorientated to person, time, place, situation, or identity. There are care measures that we can do to kind of help them with this confusion that will hopefully limit the amount of confusion they have. First care measure is always face your resident and speak to them clearly. Don't talk to them from behind because they will not recognize the fact that you are talking to them. And if you should touch them from behind, you're going to get somebody who's startled and gets very upset for the rest of the day. Always state your name. I know they're not going to remember it, but state it anyway and show them your name tag. Some residents can still have the ability to read, and they kind of like the idea that they can actually read your name tag. Give them the date, the actual specific number, the day of the week, so that they know what day of the week it is, and the time each morning and during the day as needed. If they seem to have a need to know, go ahead and keep reminding them what day it is or what time of day it is. I feel like a little cuckoo clock most days. I walk in and say, good morning, it's Thursday, the whatever date it is, and it's 7 o'clock in the morning, time to get up for breakfast. At lunchtime, hi, it's Thursday and lunchtime, and on Thursdays we're going to have this activity. So I keep reminding them throughout the day. Give them clear and simple directions and very simple answers. Do not get wordy on them. The more words, the more they have to process, and the harder it is for them to process. So be very simple, very succinct. In nursing homes, you'll notice that most every resident has a clock and a calendar in their room because we want to keep them orientated to day and time. If they wear glasses or hearing aids, make sure they're using them. They need them, so using them will help. Maintaining a day and night cycle. During the day, the light should be on, and in the evening time, you should turn them down or lower them a little bit so that people get the circadian rhythm of night and day so that they can kind of get themselves prepared for sleep. Quiet environment. You'll notice that nursing homes are not real loud and boisterous. There's not a lot of ringing phones. There's not a lot of external noise coming in. That is to keep them a little bit less agitated and aggressive. And by all means, follow their usual routines. If they did something every day and that's how they did it their whole life, keep doing it. Some people like to go to the washroom and have to go poop before they want to wash up. That's fine. Some guys like to shave after they take a shower. Some guys like to shave during the shower. If someone takes a nap after lunch, let them take a nap after lunch. Keep their usual patterns as normal as possible for them. It will also help in the long run in confusion. What I'd like you to do on page 505 in the box 35-2, Confusion Care Measures, I would like you to highlight the following bullet points. Number 3, number 5, state your name. Number 6, give the date and time each morning. Number 8, give clear, simple directions. And then the last one, or the third from the bottom, which is actually number 19 if you want to count down, follow the person's routine. So those are our important things to remember, our important care measures to remember for our residents. Now we're going to kind of go from confusion, which to dementia. Dementia, the word itself, means a loss of cognitive function that interferes with the routine personal, social, and occupational activities. That, my friends, is on page 506. It's the red italicized definition right under the heading of dementia. I would like you to highlight that, please. The rest of this slide is just some little background for you. Again, it's just informational. It's not something you need to know. Dementia in and of itself is many diseases. It is not a one disease fits all kind of thing. Dementia and Alzheimer's do not mean the same thing. Alzheimer's is a form of dementia. Dementia is called an umbrella term, which I have this really cute umbrella a few slides in for you, meaning it covers many different diseases. Some of the diseases for dementia are reversible, meaning there's something wrong with them, they're sick, and we can fix it. And some of them are you're stuck with for life, like Alzheimer's. In 2014, there were 5.2 million people with the diagnosis of Alzheimer's disease. Interestingly enough, 3 million of the 5 are women and 1.8 million were men. The interesting reason for that is women live longer, therefore we're around longer to get Alzheimer's. The reason for us talking about dementia in the first place is really because they're projecting the amount of people with Alzheimer's by 2050 will rise to over 16 million people. The baby boomer generation, which was the biggest generation that there ever was, is turning in their 60s now. And so when all these people start turning 70s and 80s, they're going to be a huge influx of people with dementia. And so they want us all to be ready and to have some knowledge base before we get hit with all of these extra people. Interestingly enough, Alzheimer's is the only one disease of the top 10 diseases, it is in that top 10, that cannot be prevented, cured, or even slowed down. Heart attack, stroke, those types of things all have things that we can do. Unfortunately, with dementia, we're not there yet. We don't know how it starts and we don't know how to fix it. Kind of sounds like coronavirus right now, doesn't it? Okay, changes in the brain due to dementia. Now, every person in this world, as they age, they're going to have some deterioration of their brain and their nervous system. They're going to slow down. Their reaction times will slow down. They'll get a little more forgetful. They'll need more reminders, more cues to do things. But dementia is not normal aging. Dementia is not something that every person in America is going to eventually get. Now, Alzheimer's, usually the longest people live is usually 20 years with dementia. So it's a long-term thing. President Reagan actually had Alzheimer's and he lasted for over 21 years. It usually occurs after the age of 60. And the scary thing is it does increase with age. So by age 85, about half the people over the age of 85 will have a diagnosis of dementia. There is no known cause for it, but there is a family history. Sorry for those of you who have a grandma or grandpa that has dementia. There is an increased risk of you getting dementia if you have family members with dementia. Now, the last item on this page, it says a classical sign of Alzheimer's disease is gradual loss of short-term memory. That happens to all people with Alzheimer's disease. On page 507, under signs of Alzheimer's disease, you will see in that first paragraph the italicized sentence that says the classic sign is gradual loss of short-term memory. I would like you to highlight that, please. Then, just because we're on this page, on page 506, please go back one. I forgot to tell you. Under Alzheimer's disease, the first sentence under Alzheimer's disease, which says Alzheimer's disease is the most common type of permanent dementia. I will be going over that in a couple minutes, but as long as you're there, go ahead and highlight that sentence also, please. Okay, as promised, here's my umbrella. The raindrops on the top are all of the things that are symptoms of all the types of dementia. These are the things you're going to see in everyone that has dementia. Under the umbrella, you'll notice the right side or left side of the umbrella says reversible. On the left side says irreversible. Or, oh my goodness, my right and left here. The the right hand side says irreversible. Those are types of dementia that cannot be fixed. So what are the symptoms that all dementia has? I'm going to clump a few of them together just for ease. Problem solving. They have problems making change. When you see an older person in the grocery store, kind of notice, you'll see them handing everybody a $20, $10, $20 bill and putting the change in their pocket. They don't generally like to have to sit and count out change because it's difficult for them to have to do the math. They have a hard time predicting their consequences. So, like if they turn a corner and they don't recognize it, how do I they don't remember to turn around and go back the way they came to try to problem solve. Senses are dulled. One of the very unique things, and I could spend hours on just the senses alone, but one of the unique things that happens with a person with dementia is they have right-sided eye preference. So people in the later stages of dementia, for some unknown reason, they lose the ability to see through their left eye. It works, but they cannot, the brain does not register it. They only can see through their right eye. So a suggestion I have for you is when you're working with dementia patients, try to stand on their right side because that will help them be able to see you and to be able to focus on what you're saying a lot easier. Mood. It's said, and I'm not sure it's always true to form, but it's said that people who in life, their adult life, were quiet, calm, easy-tempered people, in dementia, they turn 180 degrees and become the aggressive, abrasive, loud, yelling type of person. And the person who was during their adulthood a little more vocal and a little more aggressive and a little more outgoing, when they have dementia, they go the opposite also, and they're more quiet and docile and obedient, and their behavior is much easier to deal with. Can't tell you for sure it's always 100%, but families have said that multiple times. Communication. Again, I could spend hours on communication, but people with dementia will start out being able to speak sentences, and as the progression of the disease progresses, they will end up only being able to mutter and utter syllables and not actually be able to speak any words. One of my favorite ones is called word salad, where they just put in any word that starts with that letter in the beginning. So it's just all jumbled up because they can't put the words in a cohesive sentence. The words just kind of come out all over the place. And then one my father does all the time, which makes me nutso, is they can't think of a word, so they go around it. So the other day he told me, he said, "What's that word? It's, a round thing, and kids play with it." And I'm like, "Round thing, kids play with hula hoop?" And he's like, "No, that's not it. It goes through the air and down. You know what this is." And for some reason, by the grace of God, basketball came to my mind, that it comes up and it goes down. And I said, "A basketball?" And he said, "That's it. That's the word I'm looking for." They do a lot of that. So you're going to do a lot of investigating and trying to figure out what they're trying to say. Language, you maintain your primary language. You don't maintain other languages that you've learned. So if you learned Spanish as a child, that's the language you will revert to. Your primary language is kept in one center of your brain. Any other languages you learned is in another part of your brain. And believe it or not, swearing and cuss words are in another part of your brain. So you have three language centers in your brain, and depending on the damage, you'll lose some of the other ones, but your primary language is the one that you will revert to eventually. Memory, I told you just a minute ago, and doesn't is worth repeating. The first symptom is generally short-term memory loss. They remember 1929, but they don't remember 5 minutes ago. Behavior, they lose their inhibition. They will say things to you that would be like, oh my goodness, that really should have stayed inside the head. Um, they will do what they want when they want. That's very classic. And then judgment. They don't always make the best decisions. So they might come out of their room and say, I'm ready for the day. And they have on shorts and a t-shirt and it's snowing outside. So they don't always make good choices. Now, I'm going to skip to the next slide, but keep the umbrella in mind. And I'm going to talk about the left side under the umbrella, which is talking about reversible dementias. Don't get caught up in the words. This is just kind of background, please. Okay, this is just something I just wanted you to know about. I think it's important to know. The false dementias are dementias that when they have those symptoms, all the raindrops I just talked about, they have all those symptoms, but it's caused by something that we can fix. So if you hop down to the second bullet point that says common types of reversible dementia include, go to the part where it says infection. Older people who have an infection, one of the first things you'll notice is they're confused. They say things or they're not acting like themselves. Confusion or fever is not one of their first symptoms of infection. Confusion is. Illness and drugs, different illnesses, again, will sometimes make them have the same symptoms. Drugs and surgery I'm going to lump together because people who have all these drugs in their system, at times they interfere with each other and they can, especially after surgery and all the drugs they use to put you to sleep, they can come out of anesthesia so confused. And believe it or not, people who are depressed have those similar symptoms to someone with dementia. So until we treat the depression, they will have those same symptoms of as someone with dementia. Okay. The next slide is on the types of irreversible dementias. These are the dementias that you can't do anything about. Once you got it, and there's nothing you can do about it. Alzheimer's disease is the number one permanent dementia. It counts for most of the irreversible dementias, about 60 to 80% of the dementias. And we'll talk about in a few minutes the abnormal plaques and tangles, which is what causes the brain to deteriorate. The other one on this slide that I really wanted to talk to you about just briefly is the bottom one, and it's frontotemporal lobe disease. You have to be really careful with a resident who has frontotemporal disease. Try to say that 3 times. Because they are very impulsive. And if they want something, they will take it. If they have to push somebody over, they'll push them over. If they will grab your plate from underneath you and eat your food. If you're drinking something that looks good to them, they'll grab it, they'll drink whatever it is. The other thing that happened, and this is kind of going to give you a little story on, is people with frontotemporal lobe disease are kind of vicious. They don't look it, but they are. So one day I was in the dementia ward, and this lady came walking up to me, beautiful smile on her face, looked really happy, had her arms out, and I thought I was going to get a hug. But then she grabbed my arm. So she took my arm and she put it towards her face, towards her mouth, and I thought she was going to give me a kiss on the hand, which a lot of older people do. So I didn't think anything of it. But instead of going puckering her lips to kiss me, she actually opened her mouth really wide and was going to take a chunk out of my hand. Fortunately for me, my reflexes are faster than her teeth, and I didn't get bit. But they look like they're innocent little lambs, and then they come out and the little devil ears horns come sticking out, and they'll get you. One more example was I had a resident with frontotemporal lobe disease, and she was walking down the hall towards one of my other residents. Now, my other resident is probably the size of a fifth grader. She's about under 5 feet tall. She weighs probably 80, 85 pounds. And she was just standing there kind of observing the world. So my frontal temporal lobe disease lady walks up to this other woman and she leans in close, like she wants to tell her a secret or she was going to whisper something to her. And my frontal temporal lobe disease patient head-butted this poor little woman. She hit her so hard in the head, it sounded like two rocks hitting each other. I mean, it was loud. It actually brought other staff members into the hall to see what had happened. My poor little lady, my little petite lady, who got hit in the head, kind of reeled back, fell down on her butt, and was just kind of dazed and stunned. My frontal temporal lady, she acted as if nothing happened. She still had a smile on her face, and off she walked away, as if nothing ever happened. Just a sideline, my poor little lady that got head-butted ended up with a concussion and a broken tailbone from falling on the floor. Poor thing. This slide, not going to point anything out except that there is such a thing as people with Parkinson's disease can contract or can have dementia. It happens about 20% of the time with people with dementia. It does happen to them. Brain anatomy. Again, a slide that really don't need to know anything about. It's just informational, but I think this is going to help you understand what happens with somebody with dementia. Now, Trivia 101 right here, if you ever play Jeopardy, this is a really good slide for Jeopardy. Your brain is nourished by one of the richest blood networks of blood vessels in your body. A quarter of the amount of blood in your body goes to your brain. Another really cool fact is you have 400 miles of capillaries in your brain. 400 miles is me driving from Chicago to Grand Rapids and back. That is stuffed in that little skull of yours. Kind of fascinating, isn't it? Now I'm going to skip this bottom part about the neuron thing, and I'm going to try and explain it a little bit in a little bit easier jargon. So cells have to talk to one another, and to talk to one another, they form connections between one cell to the other. So think of it like a telephone system. I want to call you on the phone, the regular phone, not my cell phone. I pick up my phone, I'm one cell. And how does what I say transfer to you? Through connections of wires that go across, and they cross, and they have multiple ways they can go to get to you or your cell. So with our brains, we have one cell gets the information, and to transfer it to the next cell, it forms a connection with that cell and it transfers to that cell, and then the next cell, the next cell, the next cell. What happens with people that have dementia are two facts, and this is one of the things they absolutely know about dementia, is there are two things that happen to those connections, those wires between cells, that makes it so the cells can't talk to each other. And those are amyloid plaques and neurofibrillary tangles. Amyloid plaques are like clumps of gunk that coat your cell and basically suffocate that cell to death. So there is no the cell dies because it can't get the nutrients it needs to survive. The neurofibrillary tangles are easy to describe in fact that it's like a boa constrictor. When a boa constrictor catches its prey, it wraps itself around and around and around and around the prey and squeezes the life out of it. That's what these neurofibrillary tangles do to the cells. They wrap around and around and around and around, and they strangle the cells to death. Now, once one cell dies, cells around it start dying, and then you end up with more and more of your brain being eaten away by these tangles and the plaques. I'm going to show you this picture because the next time somebody with dementia annoys you, I want you to pop this picture into your head. I want you to think about it. I want you to realize that they really are doing things that you think are annoying and that they're just trying to yank your chain, for any better way to say it. Realize they're not. If you look on the left, you see a healthy brain. Now, this is a brain, like if I took an axe and I cut from the top of your head down to your neck, it's like a, a slice of looking at your head. I kind of think it looks like cauliflower, if you want the truth. Then look at the side with the severe dementia. There are hunks and chunks that are missing. There are spots where there are no cells that exist. So we're requiring these people, we're thinking that they can think rationally, that they can do things, but the part of their brain that controls that spot could be eaten away and is totally gone. So we tell them to do something, we want them to do it. We don't want to have to say it 5, 10, 20 times. But honestly, truly, you can tell someone with dementia something and it will go away poof just as fast as you can say it. It's not that they're trying to make you angry, that they're just ignoring you and not doing what you're asking. They simply do not have the brain power to handle what you're trying to tell them to do. This is a different picture. This is a PET scan picture. Normal, you see all the brain is all nicely all colored. Mild impairment is when you first start having the disease, and you'll notice there's some spots where like the middle chunks are missing. And when full-blown dementia happens, you'll notice that whole center part. Again, if I had time, I would love to have gone through all of this with you and explain to you what's in those parts of the brain. And that's how you see those symptoms that occur in someone with Alzheimer's disease, because those are the parts of the brain that are missing. So every person with dementia will absolutely not have the same symptoms, because it depends on where the brain cell damage is as to where what symptoms we see. So no two people with dementia will ever act the same. What works on one probably won't even ever work on another person. Okay. We're getting closer to the part that makes some sense to you. I'm sorry if I'm confusing you. I'm sorry. Please don't worry about it. None of those last few slides are on the test. Now, stages of Alzheimer's disease, there are two different factions who have made different stage numbers. The Alzheimer's Association has a 7-stage description of Alzheimer's disease. It goes from no impairment to severe decline. The only reason that is up there is because if you are going to Google information, if you like to look up things in different books, you may see where they refer to stage 3 or stage 4, 5, 6, and you're going to say, but I only learned about 3 stages. It's just Alzheimer's Association has a different staging system than other people who talk about dementia. So the stages that I want to talk about and that our book describes are a 3-stage system: mild, moderate, and severe. In mild stage dementia, usually the symptoms are kind of like vague. So somebody goes to the grocery store and can't remember what they have to buy. Happens to us all, right? Well, you just say, well, they just forgot. It was a bad day. They didn't sleep well tonight. They were in a hurry, that kind of thing. They take a wrong turn, and they forget to exit when they're supposed to exit off the highway, and they're lost. Well, because they were listening to a radio station, they weren't concentrating. That's what happened. So you can kind of make excuses for their unusual behavior because it's not all the time, and you can kind of ignore it. That stage usually lasts between 1 to 3 years. Moderate stage dementia is where the symptoms are so noticeable you can't make excuses for them anymore. There's definitely something wrong. There's more unusual moments than normal moments. Now, the moderate stage usually lasts for the longest period of time, and it can last anywhere between like 3 and 20 years. And of course, it progresses as it goes. Now, the severe stage is the stage that I want to emphasize today, and that is where people are usually bedbound. It's not because they can't walk, it's because they have forgotten how to walk. Uh, they have trouble eating, they have swallowing difficulties. You put food in their mouth and they don't know what to do with it. So, a lot of times they'll just drool, or it will just kind of like they'll spit it out. Um, they don't remember how to chew and to swallow. That's also the reason for the weight loss, is because of the swallowing difficulties. They don't eat enough calories for themselves. So this person, I'll start from the top. I'm sorry, I kind of jumped in the middle. This person needs assistance with their activities of daily living. If at all possible, please let them assist you as much as possible. Give them the washcloth. Let them hold it. Let them feel like they're contributing to this. If they want to, let them hold the spoon while you're feeding them. Let them hold an empty cup. Let them be part of this so that you're not just taking over for them. You need to monitor them for signs of infection. UTIs are huge. Pneumonias, they don't take deep breaths. Skin sores, bed sores, pressure injuries is what they're called now. Any of that can happen. They'll be totally incontinent, so very good period care and monitoring for UTIs so that you can make sure that they're safe. I did swallowing. Moaning and groaning is a form of communication. They can't remember how to make sounds anymore, or how to put letters together and just to make words. So they moan, they groan. Sometimes they even cry out. Now, I know this might sound odd, but those of you who've taken care of a baby, you can honestly tell me that different cries mean different things, and you can distinguish between the cries. It's the same thing with someone with dementia. When they're in that severe stage, you can tell the difference between, are they happy? You can tell the difference if they're hungry. You can tell the difference if they're upset or in pain. It just requires you learning a little bit about that human being. Now, that is highlighted, and I am going to have you refer to page 507 in your book, in the box 35-7, where it says Alzheimer's disease, 3 stages. Under severe Alzheimer's disease, will you please highlight number 1, depends on others for care? And again, allow them to do as much of the help, let them assist as much as possible. Bullet point number 5, skin infections, and you can also add UTI and pneumonias. Number 6, difficulty swallowing. Number 7, groaning, moaning, and grunting. And number 10, loss of bowel and bladder control. We are going to stop for today. I'll go back to that slide. We're going to stop for today. I have one little assignment for you, and it's just going to be a fun assignment. So here you go. What I'd like you to do tonight at dinner or after dinner, when you're sitting around and you're looking at each other and trying to figure out what you want to do for the evening, I want you to ask or have your parents, have your brothers, have your sisters, grandparents if you can find them, or if you want to bother them. This is an Alzheimer's test, an IQ test that they have. And the test is you're going to have this person tell you as many animals as they can using a certain letter. The suggested letters are you can have all the animals starting with letter F as in Frank, all the letters starting with A as in apple, or all the animals starting with the letter S as in Sam that they can say in 1 minute's time. So put on your timer for 1 minute, have them name all the animals that they can using the letters A, F as in Frank, or S as in Sam. If they can only get between 10 and 15 names of animals in that 1 minute span, it is highly suggestive they're in the early stages of dementia. If they're around 17 or 18, those are kind of warning signs that dementia might be coming around the corner. And if you can get anywhere between 20 and 25 animals listed in that minute, you're doing great. So we'll be back tomorrow with the second half of chapter 35. I'm going to give you some time to process and look over your highlights. And if questions, feel free to email me. It's Betty Jo, R as in Robert, at tcdupage.org. Have a great night, guys. Bye-bye.